Everyone, give me a quick thumbs up if my audio video is all fine. Everyone, please give me a quick thumbs up if my audio video is fine. I'm Dr. Chesta Aggarwal, your NEET PG educator on the best online platform that is Unacademy. Now, for the remaining days of this month, we have a lot of free live sessions available. The list is given on your screen. I request each and every one of you to kindly be a part. The next is we are launching a PYQ question bank. This is very important for those again preparing for this upcoming exam. An Unacademy Live Light subscription which give you an access to subject-wise test, system-wise test, full-length mock test, previous year questions, and test series curated by the top educators. We are launching a MBBS Prof 1 batch. We also have a doubt clarification series where you can have a exclusive subject-wise doubt resolution sessions. Now I'm giving you the two type of subscriptions. One is Plus, which give you an access to Unacademy, and another is Iconic, which give you an access to both Unacademy and Prep Ladder. I congratulate all the students who have cleared the FMG exam. We do have a lot of special classes, and I request all of you to kindly get yourself enrolled. Now we have two batches which are starting today. One is the NEET PG batch, which is starting on 30th. This is for the upcoming NEET PG entrance examination. And we have an FMG batch, which is starting again on 30th. And this is very important for the FMG preparation. We are offering you the end of the season sale. And please remember, this offer is only valid till tomorrow, that is till March. So requesting all of you to kindly get yourself enrolled. You might need a code to avail the discount, and the code is CHESTA10. So requesting all of you to kindly get yourself enrolled. Now let us begin with today's session, a very important class. The patient was treated with steroid for psoriasis. On stopping the treatment, he develops fever, malaise, lesions as seen in the image below. What is the correct answer? What is the correct answer here? Anyone can tell me the correct answer. The patient was treated with steroid for psoriasis. On stopping the treatment, he developed fever, malaise, and lesions as seen in the image below. The diagnosis is. Now, I would highly request all my dear students to kindly look at this image. You have a lot of pustules. There are discrete as well as confluent pustules which are present. Very classical of acute generalized pustular psoriasis. So please remember, you never treat a psoriasis patient with steroids because on withdrawing the steroids, the problem starts. Either patient goes into the erythrodermic form or patient goes into the pustular form. Here, looking at the image, we can clearly say that the patient went into the pustular stage of the psoriasis. Clear? Next question. All of the following infection presents with maculopapular rash. Anyone can tell me the correct answer here. Please remember, shingles, it is a grouped vesicular lesion. It's a grouped vesicular lesion. So the correct answer is option number 3. also known as herpes zoster. It's a grouped vesicular lesion, also known as herpes zoster. Moving to the next one. The next question is on your computer screen. A patient with flaccid bullous lesion involving the oral cavity skin. He has lesions as shown in the picture. Acantholytic cells are seen on zinc smear. What is the most probable diagnosis? What is the most probable diagnosis? Please tell me the correct answer. Now, always in a vesiculobullous lesion, if you get flaccid bullous lesion, this word, if you get acantholytic cells with mucosal lesion, consider the diagnosis of pemphigus vulgaris. Consider the diagnosis of pemphigus vulgaris. I hope this is easy for all of you. Next, the next. Which of the following is a true association? What is the correct answer here? Which of the following is true association? Lichen planus, malignant melanoma, psoriasis, or metabolic syndrome? Very nice, all of you. The correct answer of this question. Am I audible and visible to all of you? Am I audible and visible to all my dear students? Can I get a quick thumbs up? The answer is metabolic syndrome and psoriasis. We have associated obesity, then hyperlipidemias, diabetes mellitus, etc. Treatment of multibacillary type of leprosy. Treatment of multibacillary type of leprosy. It's 3 drugs in 12 months. We have divided the patient into paucibacillary and multibacillary. When the skin lesions are less than or between 1 to 5, nerve plus minus, and slit skin smear negative is paucibacillary. Skin lesions more than 5, nerve involvement more than equals to 2, and slit skin smear positive. This is multibacillary patients. So here you have to give 3 drugs in 12 months because it is multibacillary. While in paucibacillary we give 3. You can see the lesions somewhat like this. On the cell there is presence of a lot of bacteria. So this is known as a very classical clue cell. Now clue cell is one of the diagnostic criteria which is includes under the EMCELS criteria. I hope you all know that. Can anybody tell me what is EMCELS criteria? What are the points in the EMCELS criteria? Can anybody tell me the answer? What are the points in the EMCELS criteria? Am I audible and visible to all of you? So EMCELS criteria includes 4 points. It says that there should be a profuse discharge. There should be a profuse discharge. The pH should be more than 4.5 or maybe 5. There should be presence of clue cells which is more than 20%. And what else? 1, 2, 3. Last, very important is there should be the foul smelling discharge. So that is the EMCELS criteria. Next, a child presents with bald patch on the scalp with easily pluckable hair. Physician noted black dot on the area. The treatment to be given here would be. What is the correct answer? A child with bald patch on the scalp, easily pluckable hair, and physician noted a black dot on the area. So, what do you think? Amazing. This is a case of tinea capitis. Very nice, Ashran. And if it is tinea capitis, the treatment of choice would be always griseofulvin. Please remember, griseofulvin is considered to be the drug of choice for tinea capitis. It is a drug of choice for tinea capitis. Very, very important. Drug of choice for tinea capitis. Clear hai? Clear all of you? So, a child with a bald patch on the scalp, easily pluckable hair, physician noted black dots, the treatment given would be griseofulvin. In this question, let me just move this image so that you all can see this image more clearly. An alcoholic patient presents with a lesion as shown. He also has diarrhea. Deficiency of what will be associated? Tryptophan, serine, proline, and lysine. Tryptophan, serine, proline, and lysine. The answer is tryptophan. Why? Because it's a very classical example of pellagra. A very classical example of pellagra. And in pellagra, you will have tryptophan deficiency, which is a precursor of niacin. The patient will present with a tetrad of diarrhea, dementia, dermatitis, and death. The ulcer with overhanging undermined edges in the neck region as shown in the image below. What is the answer? KGB, Ashuran, very nice. This is a very classical tubercular lymph node which is known as scrofuloderma. It is considered to be the most common tuberculosis, cutaneous tuberculosis in children. Which mineral deficiency can lead to following conditions? Zinc, iron, calcium, or vitamin A? Which mineral deficiency? What is the answer here? Which mineral deficiency can lead to following condition? Amazing, all of you. So the answer is right. Option number one, zinc. And what is the diagnosis? Acrodermatitis enteropathica. You can see the lesions around the orifice. So periorificial dermatitis is something which is very, very easily visible in this patient. Periorificial dermatitis. First line treatment for acne comedo. First line treatment for acne comedo. Topical steroids, topical antibiotic, benzoyl peroxide, and topical retinoid. First line treatment for acne comedo. The answer is topical retinoid. We need a keratolytic drug. We need a keratolytic drug which can just remove the plug which is present. Okay, the plug, when it is removed, the sebum can easily flow out and this will improve the condition. Identify the condition shown in the image. Roma, Asuran, KGP, MRF, Radashri. Identify the condition shown in the image. Anyone can tell me the answer? Very nice. This is a very characteristic example of malignant melanoma. You can see that there is a hyperpigmented macule with variable consistency or variable pigmentation. At few places it is dark, at few places it is light. You can also see a little bit of atrophy. Okay. Now this is a very characteristic feature of malignant melanoma. This is a very characteristic feature of malignant melanoma, and the type is lentigo maligna type. The type is lentigo maligna type. Which organism is responsible for causing erysipelas? Which organism is responsible for erysipelas? Please remember the correct answer is Streptococcus aureus is responsible for the erysipelas. Erysipelas is the infection of the dermal lymphatics. So you will see a very well-defined lesion in the patients of erysipelas. You will see erythema with raised borders. And when you see erysipelas of the face, there will be extension onto the ear pinna. But the cellulitis of the face will never extend into the ear pinna because there is no subcutaneous tissue. And we all know that cellulitis is the infection of the subcutaneous tissue. Let's move to the next one. What is the correct answer here? What is the correct answer in this particular question? The cutaneous horn, as shown in the image, is associated with which of the following cutaneous malignancy? Amazing. The correct answer of this question is squamous cell carcinoma. And whenever you get the cutaneous horn, it is always advisable to remove this because if you will not remove it, it can definitely convert into SCC. So you have to ask the patient to be on a follow up regularly and get this cutaneous horn removed. Identify the condition shown in the image: condyloma acuminata, Bowen's disease, condyloma lata, or hemorrhoides. Very nice, very nice. Roma, MRF, Devakar. That is how a genital wart look like. That is how a genital wart look like. And this is an HPV 6 and 11 infection, which is very popularly known as condyloma acuminata. Patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. Diagnosis. Patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. What will be your diagnosis? Pyoderma gangrenosum, venous ulcer, tubercular ulcer, or a chancroid. So patients suffering from ulcerative colitis, this is a very classical example of pyoderma gangrenosum. Now, pyoderma gangrenosum, it's actually a neutrophilic dermatosis where the neutrophils start getting accumulated themselves inside the skin. Now, this neutrophilic collection causes ulcer, which is rapidly progressing and very painful. They are not responding to the sterile conditions or the antibiotic therapy. For them, we need to give steroids or Depson as a treatment modality. The common complication associated with the following condition. The common complication associated with the following condition. Post-streptococcal glomerulonephritis, staphylococcal scarlet skin syndrome, encephalitis, or pneumonitis. Common complication associated with this condition, the answer is PSTM. And what is this? This is a case of non-bullous impetigo. This is a case of non-bullous impetigo. Yes, you're right, Ansuran. The strain is M49. A tourist guide at Mount Everest, after one of his trip, develops blisters on the feet, which is not useful for his treatment. Hyperbaric oxygen, aspirin, phenylephrine, or pentoxifylline. Which of the following is the correct answer here? Very nice. The correct answer is phenylephrine. Why? Because phenylephrine is a vasoconstrictor. Vasoconstrictor will actually precipitate this condition. We need to give something which increases the blood flow to the distal part. Hy- Hyperbaric oxygen, aspirin, and pentoxifylline will all do the same thing, except for phenylephrine, which is actually a vasoconstrictor. Patient presented with history of severe sunburn after only a few minutes in sun, freckling in the sun exposed areas, changes in the skin pigmentation. What is the diagnosis? What is the correct answer here? Yes, this is a case of xeroderma pigmentosa. Now you can see that there are some freckles, you have photosensitivity, you have scarring in the patient when he is exposed to the sunlight. All these features give you an idea that you are dealing with DNA repair defect. DNA repair defect. What is the answer here? Child presents with sores in the mouth, a rash on the hand and feet as shown in the image. What is the causative organism for it? What is the correct answer for this condition? Very nice. It's a question with hand, foot, and mouth disease, and if it is HFMD, hand, foot, and mouth disease, if it is HFMD, then you need to give or need to treat the Coxsackie A16 viral infection. Now, child with fever, pleomorphic rash, as shown in the image, what can be the diagnosis? Shiramya, Roma, Anshuram, logical. Yes, very nice. It's a very classical dewdrop on the rose petal appearance. A very classical dewdrop on the rose petal arrangement. And where do you see this? Dewdrop on a rose petal arrangement. Yes, the dewdrop on the rose petal arrangement is a feature of a rash which is pleomorphic and polymorphic, known as chickenpox. Another one. The time of reading a patch test for allergic contact dermatitis, according to the International Contact Dermatitis Research Group, is the answer is we remove the patch on day 2 and we read the patch on day 4. So 48 and 96 hours are the correct option. Please remember the option number 2 is incorrect. There are many textbooks which writes option number 2 but that is not correct. The correct is 48 and 96 hours. Okay Shiva. Patient with severe fever, joint pain comes to you. She also have a pigmentation on the nose. What can be the likely diagnosis? What can be the likely diagnosis? Melasma, chick sign, SLE, rosacea. This is a patient with chick sign. And what is this? She's suffering from chikungunya fever. In chikungunya fever, after 2 to 3 weeks of the fever, patient develops a very classical centrofacial pigmentation, and this pigmentation is known as chick sign. Amazing. Which of the following will show canker redux? Which of the following will show canker redux? Early relapsing syphilis, chancroid, late syphilis, or herpes? Very nice, Yogesh. Anshuran, amazing. The correct answer is option number 1. Early relapsing syphilis. Early relapsing syphilis. Clear, all of you? Early relapsing syphilis will have a recurrence of the canker, and that is known as canker redux. Now, this would be the last question. A 22-year-old college student with a history of intercourse with multiple sex workers presents with centrally umbilicated lesions on his genitals. Scraping shows which of the following? Scraping shows which of the following? The diagnosis here is molluscum. I hope you all know this, right? The diagnosis here is molluscum because the umbilicated lesions are very, very classical of molluscum contagiosum. And in molluscum contagiosum, when you do the biopsy, you will see the presence of inclusion body inside the cells. What are those inclusion bodies called as? Anyone? What are those bodies called as? They are known as Henderson-Peterson bodies. Yes, they are known as Henderson-Peterson bodies. The inclusion bodies are known as Henderson-Peterson bodies. And this will be the last question, Yogesh, Arun, KGB, Shriramya. The answer here is option number 1. You have copper penny bodies, which is seen in the patients of chromoblastomycosis, which is a deep fungal infection. With this, we are done with the today's session. I hope everybody have enjoyed it. It was a brief session where I have discussed about a lot of questions. There is one more session today at 10 p.m. So I would be highly requesting all of you to please be live. I thanks to all the students who have attended this session. Please subscribe the YouTube channel Let's Crack Neetpg, and please take an Academy subscription using the referral code CHESTA10. We also have a Telegram group with the same name. Give me a thumbs up if you like this class.